Acute renal failure, causes and treatment. Acute renal failure is when a person's kidneys are not working as well as they once did. This usually happens very suddenly over several hours or up to 2 days. Treatment can depend on the underlying cause. As a result of acute renal failure, the kidneys do not filter and dispose of waste products as they should, and a person's urine output often falls. Ideally, a doctor will identify acute renal failure immediately, and treatment can begin to reverse the underlying causes. Symptoms. Often a person will experience acute renal failure when they have another serious illness such as pneumonia or sepsis. As a result, they may not observe the symptoms of acute renal failure immediately. Some symptoms of acute renal failure causes include urine that is very dark, confusion, lower urine output, itching skin or skin rashes from waste buildup, pressure or pain in the chest, shortness of breath, swelling in the lower extremities, unexplained nausea. Some people may experience severe side effects including seizures and loss of consciousness. Stages. Doctors will usually classify acute renal failure in one of 3 stages depending on test results and a person's urine output. Stage 1 is the least severe while stage 3 is the most severe. A research paper in the journal American Family Physician outlines the stages as follows. Stage 1. A person in stage 1 acute renal failure experiences a sudden increase in their serum creatinine, a kidney waste product, by 0.3 milligrams per deciliter, or an increase of 1.5 to 2 times from their baseline. The person will also produce fewer than 0.5 milliliters per kilogram of their body weight per hour for 6 hours or more. Stage 3. A person in stage 2 acute renal failure will have an increase in their creatinine level that is 2 to 3 times their baseline. They will also have a urine output of fewer than 0.5 milliliters per kilogram of their body weight for 12 hours or more. Stage 3. A person will have a creatinine level that is 3 times their baseline, or that is greater than 0.4 milligrams per deciliter. They will produce no urine for 12 hours or fewer than 0.3 milliliters per kilogram for 24 hours. Due to its severity, this stage will require immediate renal replacement therapy, a continual form of dialysis. Typically, a doctor will start prescribing interventions before a person's acute renal failure progresses to stage 3. Causes. People who are ill and receiving medical treatment in a hospital are particularly at risk of acute renal failure. This is especially true of those in an intensive care unit or ICU setting. Research has estimated that as many as 7% of all patients in the hospital and 66% of those in an ICU will experience acute renal failure. Doctors also use 3 categories to classify the causes of acute renal failure. Pre-renal. Something is affecting blood flow to the kidneys and these organs are unable to work correctly. Examples of these causes include low blood pressure, excess blood loss and dehydration. Post-renal. Something is blocking the ureters where urine leaves the kidneys, which is affecting how the organs work Underlying causes of this include kidney stones, cancer, and an enlarged prostate in men. Intrinsic renal. A medical condition damages the kidneys or something inside is not working as well as it once did. Common causes of this include kidney infections, blood clots in the kidneys, or other medical conditions. Taking medications known to damage the kidneys can also be a cause. Some medications that can damage the kidneys. Ideally, a doctor will be able to identify the underlying cause of a person's acute renal failure quickly. This means that they can recommend treatment to prevent an acute condition from becoming chronic renal failure. Treatment. The treatment for acute renal failure depends on what is causing the condition. With many potential reasons for acute renal failure, there are also many treatments. An example is when a person has significant blood loss from injury or illness, and then doctors may administer blood products and fluids to restore the blood volume. Doctors will also limit the use of medications known to be toxic to the kidneys, such as contrast dye and some antibiotics. If a person has an active bacterial infection, a doctor may prescribe antibiotics. People who have very low blood pressure may need special medications to maintain their blood pressure. Doctors usually give these drugs intravenously. People who have severely affected kidney function may require dialysis. Dialysis is when a machine acts as an artificial kidney to filter a person's blood for waste products and fluid removal until their kidney function improves. Risk factors and prevention. Some of the risk factors for acute renal failure that doctors have identified include being 65 years of age or older, having a history of chronic health conditions such as heart disease and diabetes, having a history of high blood pressure, having a history of kidney disease or kidney disorders, having a history of peripheral artery disease that affects blood flow to the extremities. If a person has gone through acute renal failure in the past, they are more likely to have it in the future. They are also at greater risk for other health complications such as stroke, heart disease, kidney disease, or heart disease. It is not always possible to prevent acute renal failure. However, there are some steps a person can take to minimize their risk. These steps include following a healthful diet and keeping blood sugar levels at their desired target if someone has diabetes, maintaining a healthy blood pressure through diet, exercise, and medications if necessary, avoiding excessive use of medications that the kidneys filter, especially ibuprofen and aspirin. Excess amounts of these medicines can damage the kidneys.